So next we'll talk about techniques based on operant conditioning. So we'll talk about 3 different techniques. We have contingency management, token economies, which we'll just touch on, and behavioral activation, which is commonly used for depression. And so going back to this idea that behaviorism is all of the outside, it's really important to have a good understanding of the ABC model. And I'm just going to say, I did not invent these terms, but next chapter, we're going to be talking about the ABCDE model, which is actually a different thing. So this week, it's the ABC model. So we have antecedent, behavior, and consequence. So again, what just happened before the behavior, identifying the specific behavior of interest, and then understanding what happened after the behavior, and whether the consequence has some sort of reinforcement quality. And so to understand contingency management, it's really important to understand reinforcements versus punishments. And the language here is a little bit tricky. So positive and negative does not refer to good and bad. It refers to whether a stimulus is presented or removed. So we have positive reinforcement, which is when a stimulus is presented and a behavior increases. So an example of this would be when a child puts away their toys, their mother says, "Good job." That would be a positive stimulus being presented, is that verbal praise. And so then the child is more likely to put away their toys next time. Negative reinforcement is when a stimulus is removed and the behavior increases. So you can think of this as being something more like likely a bad thing is being removed. So when a child studies hard for their test and gets a good grade, maybe their parents let them skip a day of chores. So the chores are being removed, and it's really encouraging the child to study for their test. It's kind of like rewarding them in a way. It's reinforcing that behavior by removing a stimulus. So then we have punishment. And so these are things that lead behavior to decrease. So a positive punishment is when something is added, when something is presented. So maybe when a child hits their brother, their father yells at them. And so that's going to lead them to reduce that behavior of hitting their brother. And then a negative punishment is when something is removed that leads a behavior to decrease. So when a child disobeys what they're told to do and their mother puts them in timeout, that would lead to that behavior decreasing in theory. And timeout is an interesting one because I think a lot of people misunderstand what a timeout is for children. Some people think of it as like a time for a child to reflect on what they did, or that it's like a punishment because they're like being put in a situation. But really the way that timeout functions is to remove all the positive things that are reinforcing the behavior. So this is considered a negative punishment because the child is being removed from a reinforcing environment and placed in a less reinforcing environment. So if they're in a room with all their toys and then they're sent to timeout, they should be placed in a room that does not have toys because you're removing something so that their behavior decreases. So it's really important to have a good understanding of how these consequences function to be able to practice behavior therapy effectively. So using these types of consequences and modifying them is under the umbrella of treatments called contingency management. And so contingencies refers to kind of like if-then statements. So if X, then Y. So all behavior occurs because of its consequences. We know that from that law of effect. So if we change the consequence, the behavior will change. So just some examples in addition to the ones I gave in the last slide. So, and we're always going to be kind of looking, like if it has like an if, then it's likely falls under this contingency management umbrella. So if a child is given $5 a week if they have no reports of bad behavior in school. If a child hits their brother, they don't get to play with a desired toy. A college student only lets herself play video games if she completes her schoolwork for the day. So these are all examples of contingency management. A related idea is this idea of shaping. And this is something that parents often do. So this is when a behavior is kind of progressively reinforced, when it's a partial kind of like movement towards the desired goal. So it doesn't have to be a complete behavior. So for example, parents might praise a 3-year-old for putting away one of their toys independently, but they're going to praise their 9-year-old for putting away all of their toys. So the 3-year-old might not be actually cleaning the room very well, but by shaping their behavior, by giving them praise when they put away one of their toys, it's helping shape the behavior so that when they're older, they'll kind of start to put away more and more toys, and then eventually they'll be putting away all of their toys. So a related idea is this idea of extinction. So a therapist is going to consider these contingencies that have maintained a behavior, and they're going to think about what needs to be removed to extinguish a previously learned behavior. So for example, let's say we have a child who cries at the dinner table, and every time they cry, they get their desired snack. So they don't want to eat what the family's eating, they cry, they get a snack that they like. And so now the parents are frustrated because every day the child is crying at the dinner table and refusing to eat her dinner. So the behavior therapist is going to say, okay, so we can recognize what the consequence is here. So every time the child cries, she gets her snack. And so this is kind of effectively rewarding the crying behavior because she is learning that crying leads to the desired snack. So the new plan will be that the child can only eat the family dinner and they're not allowed to have any snacks at dinner time. So I want you to think about what is going to happen to the child's behaviors and what happens initially versus in the long term. So eventually the child will learn that crying does not result in the desired snack. If no snacks are provided, then the crying is not going to lead to anything. However, first, the child is likely going to cry and scream more than before to try to get the expected outcome. So one of the examples in the textbook is kind of like an analogy is if you have ever like used a vending machine and you put money in and then it like eats your dollar and you don't get the soda that you were trying to buy, you're likely to like start pushing all the buttons because you're like, what's going on? Like I put money in and it's not working. And this is kind of a similar idea. So the child is going to be like, what's going on? I'm crying and I'm not getting the snack I usually get. So maybe I just need to cry more. Maybe I need to try screaming. So initially, they're going to be trying harder to get the expected outcome. And this is a really frustrating time for parents. A lot of the work during this time is the therapist kind of working with the parents to figure out how to handle this kind of like increase in the undesired behavior. But the key here is that the parents really need to be patient, not give in and give the snack, and wait for what's called the extinction burst, which is when the child will learn the new outcome. And so the new outcome here is that crying does not lead to a snack, and that, you know, eating the family dinner is kind of the option regardless of whether the child cries or not. And so eventually the child will learn that it's just easier to learn to eat the family dinner, and that the kind of natural cues of hunger will also kind of be a reinforcer here. And I know this sounds very simple. It's obviously not easy. If any of you are parents, I'm sure you know that. But it is an effective strategy, and it takes a lot of patience and kind of commitment on the parent's part, which is why the therapist is often involved in helping actually manage the parents' feelings more than anything. Next, we'll talk about a token economy. And so this is when clients will earn tokens for good behaviors, which then can be exchanged for kind of like prizes or desired reinforcements. So maybe they get toys, candy, special privileges. And this is usually used in a captive setting. So schools, inpatient units. And And it allows for very kind of like immediate, simple reinforcement of positive desired behaviors. So I put a picture of paper clips here because my personal experience doing this was when I was running a social skills group for children with ADHD. So you can imagine if you've ever met a child with ADHD, this was quite a rowdy group. So we had like 10 children between the ages of 7 and 10 who would all come in every week to practice social skills with each other. We would do games and things and practice interacting with each other. And so it's really hard to give all 10 children direct attention when there's maybe 2 therapists running this group of 10 children. And so what we did is we gave each child a cup, and if we noticed a child doing something desirable, like being patient, having good social skills, being friendly, being kind, we would just say, give them a quick good job and drop a paper clip in their cup. And then at the end of the group, they could turn in the paper clips for little toys. And so it was really interesting to me. I learned pretty quick that, a token economy is very effective. The kids really quickly learned that the paper clips were really desirable. And so this is just an example to show that it can be very simple. And it's interesting how quickly like the tokens themselves become reinforcing. However, token economies have limitations. So they might not generalize beyond the setting. So in my example, the paper clips had meaning within the group setting, but if their parents kind of started giving them paper clips, it probably wouldn't have the same effect unless it was specifically tied to a reward. And so these strategies that we've discussed within operant conditioning so far are often used in applied behavioral analysis, or ABA. This is a manualized evidence-based intervention that's used primarily with autistic children. And it really focuses on immediately targeting reinforcements of desired behaviors. So it uses a lot of that shaping principle. So any movement towards a desired behavior will be reinforced with rewards. So this could help shape social skills, self-management, encourage instruction following. And so we know it's evidence-based because these principles really work. However, this treatment does have quite a bit of controversy. Some people don't like kind of that it's used on people who maybe can't set their own goals. Other people think it's really great and helpful. And I think it's applied in a lot of different ways. But it's generally seen as a very effective strategy for shaping behavior. So the last strategy that we'll talk about within operant conditioning is behavioral activation. And this is an empirically supported form of therapy that's designed to treat depression. The overall goal here is to increase the amount of positive reinforcement in the client's life. This is done via activity scheduling, which is when a structured routine is kind of looked at and then intentionally includes pleasant, rewarding events during one's day. So the goal here is to include activities that will naturally increase somebody's mood. This is often used in conjunction with cognitive techniques that we'll talk about next week. However, some research actually indicates that behavioral activation on its own works just as well as including cognitive therapy. So the cognitive components might not be necessary for it to be effective. So I'm going to go over kind of like 10 core principles of behavioral activation. So it's based on this idea that the key to changing how people feel is to help them change what they do. And so this is really basically saying that our behaviors dictate our mood. Second principle is that, changes in life can lead to depression, and that short-term coping strategies might keep people stuck over time. So the things that we do to try to help us feel better in the short term can get us stuck in these patterns that really don't change our mood overall. And so the clues to figuring out what will be an antidepressant for a client really is involved in looking at what precedes and follows the client's behaviors. So what leads somebody to do an activity and how do they feel after that activity? And how is this impacting their overall patterns of mood? An important component is that structuring and scheduling activities are follow a plan, not a mood. So something that most of us fall into is that, we do things based on what we feel like doing. But the problem is when somebody is depressed, they're not going to feel like doing much of anything. And so it really needs to be more about committing to a plan regardless of how they feel and seeing what happens. So a person with depression might not feel like meeting up with a friend to get coffee, but they need to just plan it and do it anyway to see what happens. And these changes are much easier when starting small. So the early steps of behavioral activation will be very minor changes to someone's schedule. It's important to emphasize activities that are naturally reinforcing. So identifying things that already the client knows will likely give them a good mood, or that they can try and see if it works. And, we are all different. So somebody taking a walk might help increase their mood. Other people, it's not going to. The therapist is really acting as a coach to help support the client in scheduling their activities. And this approach really emphasizes this kind of problem-solving empirical approach. So again, that kind of like research method of experimentation. So seeing what happens. So maybe scheduling an activity and it doesn't increase a client's mood, that teaches us something. And so all results are useful. Another principle of behavioral activation is that it's not just about talking. So it's really important to get active and do things. And that might include starting to do things in session. So maybe the therapist and the client do session out in the community and get ice cream together and kind of see how doing an activity like that increases the mood. And a lot of the work is done around troubleshooting barriers to activation. So a big barrier is often clients just don't feel like doing things. And so addressing those barriers can be an important step. And so in behavioral activation, the first step is to look at an activity log. So this is just like a basic template of what it might look like. And the goal is to identify what the client's baseline is. So what does their current life look like? How are they spending their time? And so what you're going to do is have the client log all of their activities throughout the week. And they're going to note their mood during those activities. And this is really important because the client might not recognize which activities are associated with a low mood when they're asked. So an example is watching TV. So a lot of people watch TV for short-term mood improvement because when you first put on a TV show, you're going to have an improved mood. However, it might not be easy to notice when this turns into a more depressive behavior and someone's mood goes down. So we've probably all had the experience of kind of like binge watching TV. Maybe the first episode or the second episode feels pretty good, you're engaged, but somewhere around the third or fourth episode, you might start to kind of feel bad or stuck or like you're wasting time. And so the client might not naturally recognize this. And so this is where logging the activities and the moods is a really helpful step. So once a baseline for the client is established, then you can implement change. So this is going to involve experimenting with new activities and seeing how their mood changes. So this could just be pretty simple things like going on a walk, cooking a new recipe for dinner, making social plans. And initially, you're just going to implement one or two things in the week and just see what happens. And eventually, you're going to be looking for patterns that kind of naturally occur. So if on Tuesday, the client, leaves the house in the morning and then they have a more positive mood all day, you're going to try to encourage them to leave the house more in the morning. Or by doing chores, maybe some people feel better when they do them in the morning and some people feel better when they do them in the evening. So there's a lot of different activities. Exercise might be involved, getting things done, doing pleasurable activities or social activities. But it's really based around this idea of switching up somebody's activity schedule in order to promote positive moods. So overall, we've discussed a lot of different types of behavior therapy. Some of the positives are that it's relatively simple. It's really based a lot on these kind of conditioning principles, and it's a lot of fun, honestly. I think it's very collaborative with the client, and you're looking at kind of the behaviors and adjusting the consequences to see what can happen. It's very empirically supported. So in part because it looks a lot like the scientific method, it's also very easily studied. And the research really shows that it works. These methods have a lot of support that really just show us that it works. And we can do some of those case studies that you learned about in the research methods chapter. So for example, the AB design is when a therapy is kind of introduced and then taken away. And this can be easily incorporated into therapy itself. And I think one of my favorite things about behavior therapy is that it really empowers the client to be their own therapist. So you're teaching them methods that they can then generalize across different things that they can carry with them for the rest of their life, that can help them like improve their parenting skills or their relationship skills, because you're really encouraging them to be their own therapist. So unlike the psychoanalytic approach, which really relies on the therapist as an expert, behavior therapy can be kind of more time limited because you're teaching clients skills that they can then continue to apply to their own life. But behavior therapy isn't perfect. And I want you to think about what is missing here. So what are some of the barriers to simple behavior change? So, I can tell somebody how they can change a habit, but that doesn't necessarily mean they're going to. So let's go through some examples. So let's say you're doing exposure practice with a client with anxiety, but she's just not doing her between session practice. Why might she not be doing this? Or let's say you're trying to do behavioral activation with a client with depression, but they are not changing up their schedule. So you're talking about it in session and then they're not doing it. What are some of these things that are getting in the way? And I think a big one is our thoughts, beliefs, and all these internal motivators that behavior therapy kind of classically avoided. We know that these do have a big impact on our behavior. So behavior therapy, as we discussed this week, can be practiced alone, but it is commonly incorporated into cognitive behavioral therapy, or CBT, which we'll get into a lot more next week.